So when patients come in to see us, I mean, they're at that point where they need surgical intervention. So we're talking to them, say, okay, yeah, you're a candidate for a knee replacement. And then I also talk to them about this procedure that we do. It's called iovera. And they ask about what iovera is, and I tell them it's a treatment that we do prior to surgery, usually about a week or so prior to surgery, to help out with their post-operative pain. The technical term is called cryoneurolysis. Cryo-freeze neuronerves lysis. We kill the superficial sensory nerves by freezing them. The procedure only takes about 20 to 30 minutes to do. There's really no discomfort or pain with the actual treatment. I see patients getting at least 3 months of relief with the treatment. So that post-operative pain, patients are taking less narcotics, they're having better therapy, better range of motion, better rehab.
We spend a lot of time undoing things early on in terms of fear from the patient. And obviously with fear, pain is a big driver of that. Total knee replacements are very painful. So anytime you can reduce that pain level, both preoperatively and postoperatively, it makes our jobs a lot easier.
You know, when you're in a lot of pain, you want to cry. And I was not the type of person that could, take medicine, pain pills and stuff like that. I just didn't do it. I started kind of asking around about this treatment and how it relieves you of your pain, up until you had your surgery. And really, the recovery is so fast that I was all for it.
We have all of our patients come in 3 weeks after surgery, and I ask them, hey, how's your pain? They're like, I'm not having any pain. I'm no longer taking my pain medications. I mean, I've heard of cryotherapy and I knew that would help, but I didn't realize it would be that instant relief with it.
What I've seen with iovera is patients get immediate relief. In the 45 minutes that they're in our clinic, from the time we register them to the time we discharge them, we have taken care of a chronic pain problem, and they are amazed. They come in a little leery, but they go out extremely happy.
Never to the level that we've gotten with the iovera have we seen that much pain relief that quick.
Every day, Dr. Brown and I are like, man, there's another one. Look at that success story. And that just kept going on and on a regular basis with the majority of our patients.
I'm really, really happy about this new process. It's been a blessing to me.
All right, you ready to stand up?
You think I can?
Let's see. Let's see if you can stand on up there.
I'll be darned.
Way different.
Way different.
Before you were really struggling and you fell back down and you got back up. There we are, all done.
I think we're going to find that physicians and patients alike are going to be trying to find alternatives to pain medication, and I think iovera is certainly a great alternative for them.
I would encourage any nurse working in the orthopedic field to look and research iovera. It really does work. It's very effective.
What I'd recommend to a fellow physician assistant or nurse practitioner is definitely do it. I mean, this is a night and day treatment for patients.
Indication. The iovera system is used to destroy tissue during surgical procedures by applying freezing cold. It can also be used to produce lesions in peripheral nervous tissue by the application of cold to the selected site for the blocking of pain. It is also indicated for the relief of pain and symptoms associated with osteoarthritis of the knee for up to 90 days. The iovera system is not indicated for treatment of central nervous system tissue. The iovera system's 1x90 smart tip configuration, indicating one needle which is 90 millimeters long, can also facilitate target nerve location by conducting electrical nerve stimulation from a separate nerve stimulator. Important safety information. The iovera system should not be used in people with the following conditions: blood that thickens when patient is exposed to cold or cryoglobulinemia, blood appearing in the urine when patient is exposed to the cold or paroxysmal cold hemoglobinuria, skin rash that appears when patient is exposed to the cold or cold urticaria, narrowing of the blood vessels in the hands and feet when patient is exposed to the cold or Raynaud's disease, and open and/or infected wounds at or near the treatment site. Patients being treated with the iovera system, a needle-based therapy, may experience certain reactions, including but not limited to bruising, swelling, inflammation and/or redness, local pain and/or tenderness, and altered feeling at the site of application. Proper use of the device as described in the user guide can help reduce or prevent the following reactions. In the areas where you are treated, damage to the skin from being exposed to cold or heat, darkening or lightening of the skin, and dimples in the skin. Outside the areas where you were treated, muscles may not work or move normally. For more information, visit www.iovera.com.